Hello and welcome to another episode of Ask Running Writings. Today we're going to be looking at non-steroidal anti-inflammatory drugs. The question for today is, non-steroidal anti-inflammatory drugs, or NSAIDs, have a long history of use in treating sports injuries. What is their role and when should they be used by runners? Before we jump in, I do need to put a little bit of a medical disclaimer in here because we are dealing with a medical issue. And I'm a scholar, I'm not a doctor. So this video is primarily about your own discretionary use of non-steroidal anti-inflammatory drugs, not their use in medicine in general by physicians. So if you have a real medical concern, that's something you should talk to your doctor about, not me. But anyways, non-steroidal anti-inflammatory drugs are things like this. Ibuprofen, which is in Advil and Motrin, and other generic non-steroidal anti-inflammatories. Also naproxen, which is the active ingredient in Aleve. Also aspirin, which is not as commonly used anymore, and a bunch of prescription strength drugs that you've never heard of. Notably, Tylenol or acetaminophen is not a non-steroidal anti-inflammatory drug. It works by a different mechanism which has nothing to do with inflammation. But non-steroidal anti-inflammatories work by inhibiting two enzymes called COX-1 and COX-2. These both, among other things, modulate inflammation in your body. You might have heard the phrase COX-2 inhibitor. This is a class of prescription strength drugs that specifically target that second enzyme. This is stuff like Celebrex and Vioxx. They're very powerful anti-inflammatories, but they also have some very significant risks, which is why they were pulled from the market recently and why they are prescription only, of course. So the purported benefits of non-steroidal anti-inflammatories in treating running injuries is based on something you might call the inflammatory theory of injuries, which more or less states that you get an initial injury, say a tendon injury, and then there's some inflammation in response to that injury. And the inflammation itself causes a cycle of more injury and more inflammation because of pressure buildup and so on. So therefore, if we reduce the inflammation, we get a faster recovery from our injuries. But the problem with this idea and the problem with using non-steroidal anti-inflammatory drugs to treat running injuries is that most common running injuries are now known not to be associated with inflammation at all. Here's one study from 2008 that looked at a review of tendinopathy, tendon injuries. Andres and Murrell write, several studies demonstrate little or no inflammation is actually present in tendons exposed to overuse. Traditional treatment modalities aimed at modulating inflammation have had limited success in treating chronic painful conditions arising from overuse of tendons. Here's another paper on plantar fasciitis. A review of the literature and the experience of the authors, who were podiatrists, indicate that credible evidence for the assumption that plantar fasciitis is associated with inflammation is lacking. On the other hand, there seems to be substantial evidence that this disorder is associated with degenerative changes in the fascia, which may best be classified as fasciosis rather than fasciitis. In addition to these two, which tendinopathy and plantar fasciitis encompass a significant portion, but not all injuries, but it's very likely that other overuse injuries follow a similar pattern, i.e. that the pain that you're getting from the injury is the result of real damage and degeneration of tissue in your body versus just a self-perpetuating inflammation cycle. Not only that, but there's other issues associated with inflammation. Not only is it not been established as detrimental or even associated with many injuries, some doctors and researchers believe that there's an inflammatory phase of injury response that occurs in sort of the first few days or maybe weeks after an injury, and they believe that that's actually an important part of recovery. So therefore, stopping inflammation might actually prevent or slow recovery. And this is an interesting theory, and especially more so because there are some preliminary studies, which I'll flash up on the screen right now. Now, they're only animal studies, I should caution, but there are some preliminary studies that have shown that non-steroidal anti-inflammatory drugs have a detrimental effect on healing in the body, mostly tendon and bone stuff. So this is like rat tendons and cell cultures under microscopes and stuff. No human studies just yet, but still, this is something that we should be concerned about. Additionally, even though you can buy drugs like this over the counter at your local drugstore, they are still real drugs, and they still do have real side effects. Just for fun here, I pulled up the Wikipedia article on non-steroidal anti-inflammatory drugs, and as you can see, the section on adverse effects is quite lengthy. So don't forget that these are real drugs with real side effects. But you don't really have to take my word for it. Scientific literature is moving away from using non-steroidal anti-inflammatory drugs as a blanket treatment for running injuries as well. And I'll put some quotes from papers up on the screen. This is a 2006 paper by Magra and Mafuli. They write, the available literature would suggest that in the absence of an overt inflammatory process, there is no rational basis for the use of non-steroidal anti-inflammatory drugs in chronic tendinopathy. There is no biological basis for non-steroidal anti-inflammatory drug effectiveness in treating this condition, tendinopathy, and no evidence of any benefit. Non-steroidal anti-inflammatory drugs appear to be effective to some extent for pain control. This causes patients to ignore early symptoms and thus may lead to further damage of the tendon and delay definitive healing. Early non-steroidal anti-inflammatory drug administration after an injury may have a deleterious, that means bad, effect on long-term tendon healing. So that is not good news, and another paper by Stephen Stowitz and Rob Johnson at the University of Minnesota is also not good news for using anti-inflammatories. They write in 2003, because inflammation is a necessary component in the healing process, decreasing inflammation may prove counterproductive. Also, many tendon injuries called tendinitis are in fact degenerative and not inflammatory conditions. An analysis of the pathophysiology, that just means the biological changes associated with an injury, and the healing of musculoskeletal injuries questions the use of non-steroidal anti-inflammatory drugs in many treatment protocols. Because non-steroidal anti-inflammatory drugs have profound side effects, which we looked at earlier, they should not automatically be the first choice for treating musculoskeletal injuries. So, as we've seen in the past few minutes, non-steroidal anti-inflammatory drugs like Advil, aspirin, Aleve, Motrin, they're not likely to improve recovery from most overuse injuries because inflammation is not a common feature in the majority of running injuries, or at least ones that have been studied. Additionally, preliminary research indicates that non-steroidal anti-inflammatory drugs may actually inhibit healing from overuse injuries. And don't forget that these are not harmless drugs. They do have significant side effects, which again, we saw that big long list. And because the leading scientific opinion is turning away from sort of wholehearted use of non-steroidal anti-inflammatory drugs, I encourage you to do the same because there are a lot more productive things you can do to treat specific injuries. And you can check out my website for more on specific injuries, and maybe I'll make some more videos on that in the future. So that is all for non-steroidal anti-inflammatory drugs. If you want to keep up with me, you can check out my website at runningwritings.com, subscribe to my YouTube channel at youtube.com/runningwritings, or follow me on Twitter at jdruns. If you want to hear about something in the future, in another episode of Ask Running Writings, you can leave a comment below, email me at john@runningwritings.com, or click on the Contact Me page on my website. So thanks for watching, and I'll see you again next time.